I'm Julie Alexander. I'm very excited to have Matthew Gavzy with me today. Did I say your name correctly?
Yeah, yes, you did. Thank you.
Perfect. Perfect. Matt, tell us a little bit about yourself.
Oh, well, let's see. My background is in physical therapy as a physical therapist assistant, and I'm also a licensed massage therapist here in New Jersey. I also currently sit on the board of directors for the national certification for the NCBTMB.
You're the one who knows how to say all the letters correctly.
Even I get them mixed up at times.
We're always on here going, MC, I don't remember.
It's some days are more challenging than others.
That's right. So, how did you get your start in I'm assuming you got PTA first and then
No,
LT? No?
no, actually, I was a massage therapist before I became a PTA. So I became a massage therapist, was it 30 years ago now? And I was training a lot for competitive tennis. I was a tournament tennis player at the time. And I started doing or getting body work to help me and my body for training and everything. And my first degree is actually in economics. So I have a Bachelor of Science in economics. And I noticed things in the early 2000s, honestly, about where the economy was and seeing things I wasn't necessarily comfortable with. So I figured, you know what? I'm really playing with people's disposable income when it comes to doing the type of massage work that I do. And I said, I need something more stable. And I thought about getting my MSW or going alternate route as a teacher or any number of things. And it just seemed that becoming a physical therapist was the next logical step in the type of massage work that I was doing. So I put myself through PTA school. And a couple of years later, you know, the market crashed and the economy tanked a little bit in 2007, 2008. And so that's how it all started.
I have a question.
Sure.
What's MSW?
Oh, Masters of Social Work.
Okay, thank you.
Sorry about that. Yeah.
That's okay. I ask the dumb questions because people will be listening and going, I don't know what that means. So, I figure there's at least one other person out there that's going to go, I don't know what that means.
Absolutely.
So, your passion lie.
My passion actually lies in the massage world. It really does. I mean, I use the physical therapy as a way of enhancing my massage, but my passion is absolutely in the massage world. Absolutely. There's no question about it. I would give up the physical therapy world to really do massage on a full time basis. I mean, I had a full time practice before COVID happened, and then I lost everything. I lost my massage job. I lost my physical therapy jobs. Wound up working in the COVID hospitals in New Jersey during that time as a way of making ends meet. So the passion is truly in massage.
What's your favorite thing about massage therapy?
I don't think anybody's ever asked me that. That's a way to throw me a curveball off the
Thanks.
top. What is my
Tell you what my
favorite?
favorite thing is while you're thinking about it,
Go ahead.
or
Yeah,
you can
maybe I'll
totally
just use your answer.
yeah, so my favorite thing about massage is that we can learn as massage therapists how to really nurture and care for someone and get them through some really difficult physical problems without too many discomforts or too much pain and not a lot of, massive reconstruction kind of work like surgery
Yeah,
and drugs and things. So that's my favorite thing about it.
I don't know. Maybe I should just copy that answer and go ditto. Uh,
You can totally steal that answer.
I'll save that later for a
There you
for a
go.
cl- for a class or someone if somebody asks me that. So, Julie says her favorite thing. I'm just going to use that. Actually, I think my favorite part about doing massage is it's very close to that. Actually, I mean, I just when my daughter was dancing at college just last year, and my wife and I would always go to the performances, and we showed up, and I always carry a first aid bag with me in my car, just from doing all the sports massage and helping my daughter and all of her dance friends and everything. And we got to the venue to the school and everything. And my daughter comes running out of the stage door and she says, "The director needs to see you and your bag on the stage now." And I was like, "Oh, okay. What's going on?" So I get up there and she has an injured dancer and he needs to be able to perform. So the best part for me is that high that I get being able to work with somebody in that moment to be able to get them to do what they need to do, like an athlete or a dancer or anybody else who's got that pain, injury, whatever, and I can get them through what they need to do and then be able to help them afterwards or send them off to the right person, after they get to do their athletic endeavor. So that for me is the best part, that high that I really get being able to do that. So that's my best. That's my favorite part.
That's awesome. That's gosh, it gives me a little bit of performance anxiety just thinking about, like, somebody asking me to fix somebody right before they have to go on stage. That's pretty, adrenaline rushing kinda stuff, and not stuff that normal massage therapists really have to deal with, Most of the time we're in, like, a spa setting, and it's
Hmm.
calm and relaxing, not like, "Hurry up, we need to triage this person."
Yeah, it's a great feeling. I just last year got to do the A10 swimming and diving championships with LaSalle University out here in Philadelphia. And I had the opportunity to work with them. And again, they're getting tired over the course of the week, and I have to keep them going, as the massage therapist. And the coaches put a lot of trust in me, and that is just such a wonderful feeling that you never take for granted. That other people trust you and your skill set to help them. What better feeling is there?
But you've had to develop that trust, right? You don't just get it overnight. You have to gain that trust, and I'm sure you've worked
Yeah.
for them for a long time and helped a lot of people before they just trust you, right?
Yeah, I mean, everything that you do in the past leads up to the present. There are people who believe in that. I mean, so I've been the industry has been very kind to me, honestly. I mean, I got the chance to do the Olympics and the Paralympics in '96 in Atlanta, and the I've done work with the AVP Pro Beach volleyball players and both professional tennis organizations, the ATP and the WTA. So all of those things, all of those local running events and everything. So all of that kind of leads you up to. So when somebody takes a look and says, "Well, what have you done? How can we trust you?" And help them understand what you've done. That trust, you still have to earn it. You still
Mhm,
have to earn it, but it helps to open a door. About
mhm.
that, it definitely does. It helps to open a door, but then it's up to you to step through and have your skills ready.
I wanna mention something to our listeners because one of the things that I really like about my podcast is I talk about how practical ways to grow your own business and what you can take away from this. And something that just made me think about it with you, Matt, was, we really have to brag on ourselves on what we've done. So, it might not come easy to you to, as a humble person. Most of us are very empathetic and, have a lot of humility,
Yeah,
but, it's important especially when you're building your business to brag on yourself and don't feel like that's a you're patting yourself
yeah,
on the back and, "Oh, I'm so cocky." That's not what this really is talking about. We're talking about brag on yourself, show off your skills, prove that the person that's trying to hire you is able to put their trust in you with what they wanna pay you for, right?
yeah. And you're absolutely right. It's challenging for me at times to brag on myself, as I'm sure it is for many of us. We're not salesmen. We're not good at that. We prefer to let our hands do the talking, as it were. Sometimes you do have to say, "Hey, this is what I've done. This is who I've worked with," and do some of that bragging. It's still a lesson I'm learning, and it's
Yeah.
still something that I'm working on, especially when it comes to my educational stuff. Learning how to, promote myself. That's a challenge for me. And I have lots of friends who are going, "No, do it." And I'm like,
This friend is gonna say the same thing because you just segued perfectly into our next topic, which is your education. So I'm going to give you the opportunity to show off your new bragging skills and talk about your platform. What are you teaching? Why should we listen to you?
That's a good question. Oh my goodness. Okay. So let's see. Currently, I have a number of courses that I have available. I have an orthopedic procedures and post surgical precautions class. It's not a hands on class, but it's really talking about after somebody's had, a joint replacement surgery or a complex shoulder surgery. How do you work with that patient in terms of communicating with the physical therapist, the doctor, the patient, and understanding what the surgery itself was and how it's done? Because your patients, your clients, and I use the term patient and client interchangeably, so you'll hear me flip back and forth on that. They don't know what happened underneath the skin. They see a scar, they see a band-aid, a portal or whatever, but they don't understand what's happened underneath the skin. And it's up to us to really understand that, so that when the doctor puts precautions on them, things that the patient shouldn't be doing for a period of time, it's up to us to understand that. And it's up to us to be able to still work with that patient so that we don't do any harm to the patient or to the surgery. So I've built this niche, I guess, in that I am trying to do and put together those things that I know as a physical therapist assistant that I think a massage therapist should know. So it's kind of bridging that gap between the two industries. So what I'm trying to do is, as a physical therapist assistant and a massage therapist, I kind of live in two different worlds. And there are things that I learned as a physical therapist assistant that I did not learn as a massage therapist. But there are a lot of things that I know that I really believe that a massage therapist should know, especially if we're going to move massage into a medical based or a medically oriented direction as one direction, and there are many directions for massage to take, but we'll focus on this one for now. So, what I'm trying to do is give massage therapists that information. And I have a class called Orthopedic Procedures and Post Surgical Precautions. And it talks about those things like the surgeries, total hip replacement, total knee, shoulders, total shoulders, rotator cuff surgeries. It talks about the surgeries. It talks about what's really happening underneath the skin, because our patients and clients, they don't know what happened. They really don't. And they're going, why does this still hurt? Why is this taking so long? It was fixed. They don't have a good understanding. And doctors really don't explain it well, whether they choose not to or they feel as if they don't have the time. And so I think it's important for us to be able to understand what those surgeries are, because we do get a lot of those patients who have had surgeries and who believe that massage can help in their recovery, and it can. But then it becomes our responsibility to understand what's happened underneath the skin and to understand and have conversations with physical therapists and the doctors to understand what the precautions are. In other words, those things that a doctor doesn't want the patient to do for a specified period of time so that the surgery can take and heal and everything else. And while the class is not a hands-on class, there's a lot of information that goes on. And we need to up our game. We as massage therapists, we need to be better at this. And so that's what this class is about. I have another class that talks about stability taping, right? So the last, I don't know, 10 years or so, the massage therapists have really leaned into the kinesiology taping. So that would include the rock tape, the K tape, the kinesio tape, all of these things. So I'm just going to put it under the umbrella of kinesiology taping. And we've leaned hard into it. And, I have friends who are instructors and everything, and there's a lot of great stuff. that kinesiology taping can do, especially for somebody who's active or at whatever point they are in their healing process. But there are times when we get that weekend warrior who comes into our office on a Monday or Tuesday who's played, I don't know, soccer over the weekend or tennis or something. And they come in and they're like, my knee hurts and their knee's swollen. Or, I think I twisted my ankle, and you can see that their ankle is swollen. And we have an idea of what may have happened, but we also know that, if we're into taping, that kinesiology taping may not be the best thing. We want to actually stabilize the joint, keep it from moving until we can refer the person out to their doctor. And so that's what this course is about. I do tapings for the shoulder, the knee, the ankle, and it's always expanding the body parts and the types of taping. But there are definitely times when keeping a joint immobile for a period of time is the best thing for us to do, while the body's going through that acute healing process, because we all have those clients who think of us as their primary musculoskeletal therapist. They don't run off to their primary care first. They don't run off to their orthopedist first. They come to us because they trust us. And that's the best part, is we have that trust with our clients. And so we should understand and learn how to be able to do some of these things. So again, bridging that gap, I have two ethics courses. One is humanism in massage therapy. So we talk about humanism and the history of humanism. And while we are empathetic and compassionate, but how does that fit into a bigger model, you know, of, and it's not just looking at the person as a whole. It is holistic in that respect, but it's really understanding where this all comes from. And how can we really help our patients on a different level? So I talk about that. And then I have another ethics course about sports massage and working with the professional versus the amateur athlete. So you're a therapist and you have a professional athlete and you have an amateur athlete. You've got different things that are happening. You know, the professional athlete has sponsorships and coaches, and they're making a living off of their body. When you have the amateur athlete, we handle them differently. They may be a high school athlete, so you have the coach and the parents who are chattering in your ear, help my student, help my child, or whatever. How do we work with that? How do we know where to draw a line and say, you know what, this is not what's in their best interest? So I've got that. I'm working on a class for gait dysfunction. So that's going to be a long class. That's going to be like a full 2-day class, because we're going to talk about hands-on stuff and different gait dysfunctions, from Trendelenburg to plantar fasciitis and how that affects gait, and somebody who's got knee problems. So looking at that whole chain, and really looking at gait and how to break that down and decide where you need to look, what you want to look at, because we learn about gait in massage school, but we don't learn how to break that down like a physical therapist does. So that's just one class. And I've got others that I'm working on and developing, and working with a more in-depth assessment course. Again, learning how to do assessments from the physical therapy perspective, looking at the body differently, different quick tests that we can do that they do that are clearly within our scope, but how to gather different information than what we do now. So staying busy, and
It sounds like it.
yeah, working on a lot of different things, which is good because I like to stay busy that way.
So I wanna kind of present to you kind of a summary of what I see that you just told me.
It's a
And
lot of stuff. You
please
you
correct
asked, I threw
me.
it all out.
Yeah. Just please correct me if I make a mistake in my some of my assumptions, okay? So it sounds to me like you're helping massage therapists translate what doctors want to see from us and the services that we give to their patients that are also our patients.
Yes, that's a really good way of putting it. It's us understanding them and they understanding us,
Yeah.
and what it is that we can really do and how we can help them. We always say we can help them, we need to prove that. And
Yeah.
so that's what I'm trying to do is give everybody those tools.
I love that you're setting up a challenge for us out there. Matt's got the gauntlet set down, folks. Let's see what we can do to help him. I mean, I just love the fact that you're looking at this in a way that makes sense because a lot of us massage therapists are intimidated by talking to medical professionals. And there's nothing wrong with that. I understand why you feel that way. We have not been trained to have a communication with a medical professional in this capacity. We don't have the knowledge. And you
Right.
should be a little scared of that because you want people to trust you, but yet you might not have the knowledge to really execute what the doctor wants from you. And
Right.
Matt is presenting a way to take this information from one of us, not just a another doctor that might speak over our heads that might not really understand the way we think. But Matt, you understand us and know that we might not be able to speak comfortably with their medical doctor or their surgeon, but you can help us understand really what's going on and how we can help.
Yes.
Good.
Yeah. That was, I'm going to have to remember all that because that's really good.
Well, the good thing is
Well,
it's
you're
recorded.
helping me
You
out a lot. You're helping me out so much.
Well, it's recorded now, so you can listen to it whenever you want.
Take my notes. Julie said this. I'm just going to steal this.
So, Matt, we are working together to get you to come to Dallas, right? So, tell us about what we've got working.
I am so excited to be coming to Dallas. It's going to be great. March 22nd and 23rd, I believe, are the dates that we are looking at. Going to be in the Dallas area, and going to be doing two classes, one on Saturday, one on Sunday. The Saturday class is going to be the orthopedic procedures and post surgical precautions class, and Sunday we'll do the stability taping class. So I am absolutely so excited to come down there. I've never been to Dallas before, so this is going to be a real treat for me.
Good.
Uh, really looking forward to it.
We're excited to host you. If you're listening and you need some credits or just want to learn something cool from Matt, please take a look at the handcraftedtherapysupply.com website. We're going to have registration open. Also, if you're interested in Matt's other classes, you have a website they can go to as well, correct?
I'm revamping my website, so but they can always reach out to me via email or my phone. So my email is bodyworkingsmt@gmail.com. I'm also up on LinkedIn, so you can look me up there. And my cell phone number, and by all means, please reach out to me via my cell phone. You can text, you can call. It's always available to you. It's 201-410-7855.
Thank you so much for that. That's incredible. I mean, we've got this just incredible resource before us that's providing his personal cell phone number and his email address. So if you have any questions for Matt, please reach out to him. And man, if you have any questions about the classes coming up in Dallas, please reach out to us at Handcrafted Therapy. I am really impressed with Matt. Our good friend Maggie Troop took his class at the AMTA Tampa National Convention back in September. And if any of you guys know Maggie, she is just a rock star of a person in the massage
He is.
industry. She is a nerd and I love her to death. She's our anatomy expert and CBD queen, cannabis queen. So she took Matt's class and she has not been able to stop talking about how much she just loved it. So, you know, if you want to be a rock star like Maggie, and that's what I want to be when I grow up, I hope she watches
Me
this
too.
episode and listens to this.
Me too.
All right. Anything else you want to share with our listeners or any nuggets of information you've got that, anything else you want to share?
Well, the one thing that if you're wanting to work with this population and communicate with doctors, I would tell you to really understand your anatomy and your anatomical terms because doctors and physical therapists talk in those terms every day. It is a second language for them. And to understand that is going to go a long way for our credibility as well. So if we can at least talk in their language using proper anatomical terms, that's going to give us some credibility.
Yeah, I agree. I totally agree. And, speaking of Maggie, we're working together to come up with anatomy refresher course in
Oh,
Dallas at Handcrafted
nice.
Therapy. So that should be coming out. Hopefully, it'll be before your class, but I'm not sure. We're saying spring right now. So keep your eyes
Nice.
open for that because, it's such a good way to like, I mean, we all forget, like, we're like the arm
Yes,
bone, we just forget because we don't really speak in those terms. And I
it's
think that's
true.
absolutely right. We need to refresh our anatomy skills.
We're so used to talking to our patients, our clients in plain, simple terms that they can understand that we forget the other side of it, you know? And yeah, I mean, the better we can do with that, the better I think we'll be.
Yeah, I agree. And the more justified our profession will be in the bigger picture of medical professional, right?
Yes. Yes.
Yeah. Matt, I have a bonus question for you.
Did I have to study for it?
Not at all. This
Oh,
is
good.
a fun question. And if you can't think of anything, it's okay. We'll just cut it off before this question. But I'm putting together every time I do an interview. This is a bonus question that could end up in my book deal someday, which I hope to get. I'm going to call it Tales from the Table.
Nice.
And if you're interested in
Nice.
participating with this, I'm asking each of my interviewees this question or similar question thereof, which is, do you have a story that is really quite extraordinary, either funny or disgusting or weird or just
Oh
something
my
you want
God.
to share from the table?
It's funny you say you call it tales from the table because I was actually years ago thinking of doing something like if my walls and tables could talk
Yes.
kind of thing. Wow. What would be the strangest thing? It's well, there's been a few, and it's like, how do you like actually say this? Let's see. So I had one time, I had somebody come in. She got on the table and started working on her, and then like, okay, face up, and then I moved to her legs, and she's wearing like thigh highs, and I'm like, no, this is like not happening. She starts like making a pass and doing things. And I'm like, no, God, we're done. Oh, for the time I had, and I am sure that I am not the only person that this has happened to, especially to the women. I had that male client who I'm working on whose hips start undulating as I'm working on his back. And I'm like, need to stop, right? We're done. Funny story. I had a client who was actually a mortician, wonderful guy, very nice, very funny, came to me for a massage. She was self-conscious and everything, and was having, some personal issues, with his wife and everything. And, very innocently, as I work on him, as I was working, he was getting embarrassed because he was having a reaction. Can I say it like that? He was
Yeah.
having a reaction. We kind of know where that's going, right? He was so mortified. I mean, just he was like, "Oh my god, I'm so embarrassed and everything." And we talked, we worked through it and everything. And I remember one day he goes in, he gets on the table, right? And I walk in, and already there's a reaction, and I'm like, "Stop!" Like, what the hell's going on? So he reaches underneath the sheet and pulls out a banana. He throws the banana at me. I'm like, "That's funny.
That's funny.
That that's a funny story." That's
Okay, I have
probably
a
one of the funniest
question
stories.
for you.
Oh, no. What we
I
have
know.
that what, the number 2? You said
So,
1, now we're up to 2.
well, I have a question because
Okay.
I'm just thinking now about our listeners, right? And how most of us are in the industry that work in this industry, most of us are female. And,
Yeah.
when something like that happens and we shut the conversation off very quickly, it might be a little different than what it looks like for you and your client. So, how did you what did you say to him, and how did you get through that?
I mean, we had had a number of conversations in our sessions, and it wasn't like I was psychoanalyzing or anything like that. So I was not overstepping boundaries, but he was just confiding in me more than anything else. And I think, you know, I was providing that unconditional touch that we provide as therapists. And guess for him, that kind of opened up an emotional kind of floodgate for him. And again, I know that this has happened to hundreds, if not thousands of us, as massage therapists, whether you're a male or a female. I mean, and that's just, you know, part of the good that we can provide to somebody, you know. But it took us a number of sessions and we talked and we laughed, you know, and over time he just became more comfortable with me. So that reaction didn't happen. Yeah, and he stayed a long time client of mine for years. Sweetest man ever. Truly,
So there
truly.
was
So
nothing like there wasn't like a hard-nosed conversation you had about him, like, oh,
no,
yeah.
because when he came in originally, he had hinted at some stuff that was going on in his personal life.
Mm,
And so, unlike the guy who had the undulating hips, that was a hard cutoff. I um I think trying to understand where he was coming from, trying to put a little empathy into,
mhm,
my thought process, and realizing that he was not looking for anything sexual, and the fact that he was so mortified
mhm,
by what he was, feeling and dealing with and having this reaction. I think that changed my reaction
mhm.
to it,
Yeah.
you know.
Yeah.
So I think that's why I didn't give it a hard cut off and everything. I mean, look, sometimes the sessions only lasted 20 minutes,
Mm,
and the rest of the time was talking or whatever. But that's what he needed.
yeah.
And I was just a listening device. I was just a sounding board for him to talk. And like I said, I offered no advice or anything else like that, not playing psychologist, but just doing something that we as massage therapists always do, which is listen.
Yeah. I love that. I mean, it's just so wonderful that, it's wonderful and complicated at the same time that we can't separate emotions from the physical body, right? And
Right?
so sometimes when we're dealing with humans, right? And we're all imperfect, and our emotions and our physical being are not separated. They're one and the same thing. And so you
Yes.
can't not let the client talk. I mean, you can not let them talk, but I mean, they're gonna have feelings whether you talk about it or not, right?
Yes. Right.
A lot of it's held in the muscles, right? I mean, a lot of that emotional release and
Yes.
things like that are held in the muscle. Not to
Yeah.
change your funny story into something serious.
Oh, no.
I
Absolutely.
I think this is an important topic to discuss. A lot of us deal with these problems all the time, depending on where you work
Hmm.
and, you know, like your whole situation, right? And obviously, and I'm so thankful you shared your stories. Thank you so much for doing that because some of them are, I mean, we all get in these weird situations in the massage room. Massage is kind of weird. I mean, you're going to a strange person to get undressed, to lay on their table so they can manipulate your soft tissue. It's just kind of a strange concept, right?
Right? We were told as what kids, like, don't get into cars with strangers. And what do we do now? We jump into an Uber or a Lyft all the time,
Yeah, that's right. That's
right?
right. I mean, we because of the vulnerability of our clients, like being undressed and on the table and face down, what a vulnerable situation to be in. You have to
Yes.
establish that trust somehow so they will continue to come back. That's how you
Yeah.
become a successful, massage therapist,
Yeah.
right?
I've always looked at what I do, and as what I do, I'm getting to work on somebody's body. And in this world, in this life, that is the one thing that is truly theirs, right? their life, their body, that is theirs. And I've never looked at it as it was their privilege to have me work on that, right? And we all know people who kind of take that perspective in whatever arena it is.
Yeah.
I mean, I can tell you, I know doctors who are like that, like, hey, it's your privilege that I even found a spot for you in my busy schedule. You know, I always looked at it, it was always my privilege and my honor that they allowed me into their world to touch their body. Like you said, when they're in such a vulnerable state, various dresses of undress, under a sheet, you know, power differentials, right? We've always talked about that in massage school. One person is standing, one person is horizontal. So many things come into play that I always looked at it. It was always my privilege and my honor that they allowed me to help them in whatever way. So yeah, and I've carried that through for 30 years in all of my practice.
That's amazing. I love the reminder of humility that our profession just gives us all the time. I mean, asking for it or not, you're going to get it. I mean, one of my favorite things about being a massage therapist is every day I am more and more just in awe about our bodies and how incredible this structure is and how
It's
little we
crazy.
know, right, about it. So I'm just so thankful that we have so many passionate, empathetic, wonderful massage therapists out there. We love you all. Please know that we are on your side.
Yep.
We are fighting the good fight with you. And we're wanted and needed even more right now with all the stress that's in the world. I mean, there's a lot going on and this is not new, but it still sucks. So hang in there, keep going.
Yep.
Check out what Matt's got going on in his world. If you're looking for some CE classes, keep him on your radar for upcoming classes.
Thank
Uh,
you.
Thank you, Matt, so much for your attention and your time and
Oh,
wonderful, talk.
it was my pleasure. Thank you for allowing me to share my story with your fans and everything. Your podcast is amazing. I love it. So
Thank
thank you so
you.
much.
Thank you so much. All right, you have a beautiful day.
Thank you so much for joining me on the Handcrafted Therapy podcast. I would love to hear from you. You can email us at podcast@handcraftedtherapy.com, or you can come by the store. It's at 3303 North Central Expressway, suite number 240 in Plano, Texas, 75023. Or you can connect with me on social, Instagram, Facebook, #handcraftedtherapy. I'm Julie Alexander, and I wish you a very happy and healthy day.